Hi, I'm Gary Bebow, CEO of White River Health System, and this is my August CEO Connection. You know, we've had the residency program at White River Medical Center for, well, over a year. And today I have as two guests, Doctors Antony and Germain. Dr. Germain was in our initial class of 10 that started July of 2017, and Dr. Antony, to my far right, is one of the new classes that just started in July of 2018. So first I thought I'd like to talk to Dr. Germain about what her experience has been this first year. I can say, Doc, that man, all the feedback I've gotten from everyone that's been involved with you folks has been so positive. I think it was kind of fun, though, when you first started, that some of the doctors and the faculty and the staff were obviously excited about having you here, but also noticed that y'all are pretty green and needed to gain some experience. But after just a few months, I think that those comments were certainly less, and y'all have become a real stellar group of 10 first-year residents. So tell me a little bit about the first year and how it's gone for you.
I can honestly say that the first year literally went by as a blur.
Mm-hmm.
I'm surprised that I'm already in my second year, but it wasn't easy, I'll admit that. It had its challenges, but it was a very invigorating experience. I enjoyed every bit of it. I got to meet quite a few people, getting to meet the staff especially, who kind of really helped make the process a lot more easier. And we came here to learn, and I can say that I've learned quite a lot. Mm-hmm. So taking what I learned in my first year, I'm excited to bring that knowledge into my second year, and of course to continue to learn more.
Now you got additional responsibilities. Not only you got to learn, but you got to help the new class coming on to.
Exactly.
Yeah. I bet you've grown, bonded well with the other 9 the first year.
Yeah, we sure did. We kind of consider ourselves as a second family, per se. Mm-hmm. We like to hang out when we have the opportunity to. Mm-hmm. But other than that, we are pretty close. And I think that right there really helps the program to be a little bit easier. Mm-hmm. When you know you have other colleagues that are in the same position as you, and you're sharing all the ups and downs at the same time.
You know, it's really important to us as we develop the program, and we want to improve as well. And so, mm-hmm. you all being our first year, it's really going to be important that you share with us any areas for improvement that you find. And so, mm-hmm. have you given any thought about that? I was like, what's what really went well this first year, or anything that you kind of wish that we'd do a little bit better on going forward?
So, with that being said, it was kind of difficult because we were the first class, and it was a learning experience for every single one of us. Mm-hmm. The only thing I can say is that knowing what challenges we faced, I'm taking that opportunity to help the second class after mm-hmm. me. So I think that's where most of the issue lies. Any
regrets that you came to Batesville for your program?
No,
You'd do it all over again?
I would do it all over again. Well, my hands are not being tied. But yes, I have enjoyed every step of the way.
Oh yeah, well, we've all certainly enjoyed having you in your class here as well. Dr. Antony, so you just started.
Yep.
And so talk to me a little bit about, I know you went through a lot of interviews in the selection of a residency program, but mm-hmm. what finally was the deciding factor in coming to our program?
Well, I think it was my interview itself. Like, I came here and I don't think I've had a better interview, like, during the whole season. Like, my interview with Dr. Kaswani and Dr. Smotherman were like the best. They made me feel at home. I was relaxed, and everyone was just really friendly. Even the residents that we met. Machel was actually one of the residents that took me on my tour and who, like, introduced us to the program itself. So they were all like really helpful, and on my initial day I felt like, this is where I wanted to be. So I knew from the time I came for my interview this was going to be my first choice. So I'm really glad I'm here right now.
Any surprises after this first month or so of being in Batesville that was actually a little different than what you thought it might be? Or
Not really. I mean, I knew from the beginning everyone was going to be friendly. Everyone was super helpful. Like, even inside the hospital, outside the hospital, anything I need, always there are people there to help out. So, no big surprises as such.
Mm-hmm. You know, about, 20% of the time you're here, you're actually in the clinic, and then about 80% of the time you're actually in the hospital. I think it kind of works out that way.
Yeah.
And so, either setting you kind of like more so than the other, or it's just pretty much both?
I'm actually in rheumatology clinics now,
yeah.
so that's the only experience I've had for the first month right now, but it's been great so far.
Yeah.
Yep.
Dr. Singh, I know he really enjoys
Yes.
teaching, and
Yes, he
I
does.
bet he's a great resource.
He is.
Too.
He's
So,
amazing.
how about you, Dr. Germain?
I love the
setting do you like?
outpatient
Do you?
setting. That is my primary goal. I do want to be involved in primary patient care, and so every opportunity that I have to be on the clinic side, I take it. Not to say that I don't like the wards or the hospital itself. I think I get the bulk of the experience and learning experience in the hospital, which I can definitely take with me outside. So I've enjoyed it.
Well, periodically, I want to have you folks and other residents come and interact with me again on the CEO Connection, because this is such an important project for us, and it's an initiative that really will secure having primary care physicians in our area to take care of our community in the future. So we're off to a great start, and to a great deal of credit of the leadership within the program, but you folks and the hard work you all are doing. So you're representing yourselves and your classes so well, and so we really appreciate that.
Thank you so
thanks
much.
today and spending time with me.
Thank you for having
Thank you.
us.
Employees of the Month to recognize for August. First, from Stone County Medical Center, Peggy Phillips, an RN in the nursing department, has been recognized for her great work ethic and being courteous and such a great representative for nursing. Peggy's been in the White River Health System for 22 years, and the last 3 of those have been at Stone County Medical Center. At White River Medical Center, Kathy Loggins, our lead biller in the clinics, is recognized as Employee of the Month representing Involved. Kathy's been with us 17 years. Based on my memory, Kathy was one of our first Employees of the Month when we started the program several years ago. So a repeater. Kathy's been, is, and always has been a high performer at the institution, and so congratulations to Kathy, and congratulations to Peggy for this way of recognizing their service to the health system. I have some new providers that I want to recognize that are starting in this August time period. In our hospitalist program, we have Doctors Jared Anderson and Caleb Oster, who's joining the hospitalist program. Both of them, we've been looking forward to joining us, having had interaction with them for several years, and so they'll be starting with us soon. Dr. Chinayan, a pediatrician, will be joining Drs. Moody and White practice in the Medical Arts Building. Dr. Wesley Greer, an orthopedic physician specialized doing a fellowship program in sports medicine, will be joining the other orthopedists, Dr. Allen, Angel, and Carpenter. Dr. Stacy Pollock, a OBGYN physician, will be joining Drs. Carlton and Applicant in the women's clinic. And finally, Dr. Prabha, an internal medicine physician. As you see these new physicians who are joining the staff, be sure to welcome them aboard. Each year we do a men's prostate screening event, and on September 18th it will be held in the Josephine Ray Rogers Conference Center. As in the past, we need volunteers to best accommodate those men that come in for their annual screening. And so if you're able to do that, please contact Bailey Williams in our Com Health Department. The annual Health First Women's Health Expo is scheduled for October 23rd at the Batesville Community and Aquatic Center. If you're available to help in that event, please contact Bailey Williams for assisting, and also booth space for those services that we provide here within the health system. So please mark on your calendar October 23rd. I'm pleased to announce that White River Health System has acquired the Mountain View Family Practice Clinic with Doctors Michelle Bishop and Ron Simpson and Callie Taylor, APRN. those providers in Mountain View are tremendous representatives of the medical community, and we're really proud to have them become a part of the White River Health System's clinics. So if you need to make an appointment, be sure to call at 870-269-4144 for appointments. As you've seen, we've been working on a new entrance to the hospital off from 20th Street, and currently we have scheduled a ribbon cutting for August 30th. The new entrance is made possible by a significant contribution by our hospital volunteers, and the new entrance will be named after that contribution. So if you're available for that day on August 30th, be sure to come out and join us. You know, the new entrance will make it much more convenient for patients, visitors, employees to access the hospital. And also we'll be creating more parking spaces for employees as well, some 29 new spaces. So I'm really looking forward to having the project completed. A great deal of gratitude should be expressed to the city of Batesville and Independence County and their assistance in helping us put this together. So it's been a project that we've been working on for, as you all know, several months, and it's finally being completed. But what a great new entrance that we'll have to the hospital. So that concludes my August CEO Connection. As in the past, if you have any suggestions on how we can improve it, be sure to let us know. So thank you and have a great month.